Well, the cochlear implant is amazing in that it's the first effective treatment to return a human sense. And it's really transformed the lives of many deaf children who now have the ability to speak and to understand when others speak. But if you look at their outcomes as a group compared to children born with typical hearing, there's much more variability in outcome than children with typical hearing. So what we really want to do is to be able to identify who's going to need more help, who's going to need more effective early intervention. And if we have a way of predicting who's going to be a high language learner versus a slower improver, a lower language learner, that also gives you a way to develop new behavioral treatments and test them. You can say, hey, this group of children, we can accurately predict they're going to struggle, and then you can try tweaking or developing new behavioral therapies to develop listening and spoken language and see which is going to be more effective and potentially which is going to be more effective for different brain types, because our prediction is based on brain structure. Well, machine learning, I mean, AI is a hot topic, and everyone thinks it's going to be able to accurately predict all sorts of things. But I think, as everyone knows, there are limitations. There was an important article that came out in Nature in 2024 that talked about that if you have a very if you have an AI algorithm that's accurate in one population, and then you apply it to a different population, then the training data that the algorithm learned on, the accuracy can really go down a lot. So deep learning, deep transfer learning is the latest type of, most advanced type of machine learning for prediction, okay? So we wanted to see if deep transfer learning would be more accurate than machine learning, and we thought that was our hypothesis, that would be the case, because deep transfer learning is better at dealing with what's called heterogeneous data. And we really wanted to do this for many reasons, to improve accuracy in general, but also we want to build a real world tool. We want to see if, it's a lot of work to train these algorithms, and it takes a lot of data to have them work in a fashion that's accurate, okay? So if we develop one that's good for, say, in English in the US, well, if every country has to then train it and retrain the model or create a different model, that's a lot of work, that's a lot of expense, that's a lot of expertise. But if deep transfer learning could give us accurate prediction with very heterogeneous data, meaning children learning different spoken languages, different family language, children with different outcome measures being used to measure how much language improvement there is, children where the MRI protocol to look at the brain is not exactly the same, okay? If with all of that variation, if we can still get accurate prediction, then that opens the door to potentially a single model being useful across the world or much of the world. And so, that's something that could translate more quickly into something that could be used in a practical, clinical way in the world, as well as for research. So, one size doesn't fit all. Some kids are going to need more intensive therapy to help them with listening and spoken language ability, other kids less. So it could help us, we call it a predict to prescribe approach. It could help us determine what is going to be the best dose and potentially the best type of approach And also, there's a potential. I mean, I don't see this as just something that could be used for children who receive cochlear implants. I mean, the concept of using imaging technology, if not an MRI, which is a more expensive technology, but these kids are getting it anyway before their surgery. There are other ways of imaging the brain that are less expensive. And potentially, if we can predict language outcome from uh, information about the brain, then maybe we can identify hearing children earlier who are going to need help and therefore be able to start early intervention before we know they have a language delay, because kids don't start talking until over a year of age, right? Well, if we knew at birth this child was at risk to develop language more slowly and not have as the same robust outcome with language as another child, there's the potential to do something earlier. I mean, our study was a collaboration between centers on 3 continents, the University of Melbourne in Australia, the Chinese University of Hong Kong, where the kids' family language is Cantonese. And then at our hospital in Chicago, we contributed 2 groups of children, children learning English and children learning Spanish. And we looked at how, and so we looked at these models, these prediction models of language. So they were fed information about the preoperative brain structure based on MRI. They were fed information about the child's hearing before the implant, and then about their outcomes afterwards. And we're predicting not specific scores, but high versus low improver. Okay. We looked at models that were trained on individual centers' data, and also models that were trained with multiple center data to see if they could accurately predict, because that's much more heterogeneous data. And we looked at, what would do better, machine learning or deep learning? And it was deep learning. And we looked at different state-of-the-art deep learning models. We found that one particular of these models, deep transfer learning models that we looked at, was particularly effective at looking at being trained on this very heterogeneous data, and yet, regardless of which family language, which outcomes protocol, which country, the children were from, that we could still get accurate predictions. So, we feel that is a nice sort of feasibility study that maybe we're heading in the right direction. And we're actually at a point now where we're trying to recruit centers worldwide that have patient populations that speak different languages, and that obviously use different outcome measures and different protocols. And we believe that if we can increase our training data, we're going to be able to do this across more languages, but we need more data to train the algorithm.